The shift nobody is talking about. Did you know that in July 2026, your health officially becomes a financial asset? For decades, health was treated as a personal matter, something separate from money, separate from investments, separate from retirement planning. That separation no longer exists. With new Medicare rules and structural changes in healthcare economics, longevity is no longer just about living longer. It's about protecting wealth. What used to be a monthly expense is quietly transforming into a long-term financial strategy. And most people haven't noticed yet, not because the information is hidden, but because it's uncomfortable. It forces a simple realization. Your future financial stability depends far more on your body than on the stock market. Why retirement planning is broken. Traditional retirement planning focuses on three things: how much you save, how you invest, and how long your money lasts. But it ignores the single largest variable in retirement outcomes: health deterioration. Medical inflation has consistently outpaced wage growth, pension growth, and average investment returns. Over the last decades, healthcare costs have grown faster than inflation itself. This means that even well-funded retirement accounts can collapse under medical pressure. Not from poor investing, but from preventable decline. And this is where most models fail. They assume health costs are fixed, predictable, linear. They are not. The invisible financial drain. There is a cost most people never calculate: the invisible cost of neglect. Focusing on only one aspect of health while ignoring overall maintenance creates a hidden liability. A liability that compounds negatively over time. A single unexpected health incident can cost tens of thousands of dollars. Surgery, hospitalization, long-term medication, reduced mobility, loss of independence. And once it happens, there's no compounding your way out. You can't invest your way out of chronic disease. You can't outperform medical inflation once your body breaks down. At that point, every dollar saved becomes a dollar spent on survival, not growth. Biological arbitrage explained. This is where a new concept enters the conversation. Experts call it biological arbitrage. It's the idea of using innovation, prevention, and early intervention to avoid massive future medical costs. In finance, arbitrage means exploiting inefficiencies, buying low, avoiding losses before they happen. Biological arbitrage applies the same logic to the human body. Spending small amounts today to prevent catastrophic expenses tomorrow. Not because it feels good, but because it makes financial sense. The numbers, most people ignore. Let's look at reality. Obesity-related diseases alone account for nearly 20% of total healthcare spending in the United States. Diabetes, cardiovascular disease, joint degeneration, sleep disorders, cognitive decline. For the average retiree, this translates to roughly $1,700 in additional out-of-pocket medical costs every single year. Over a 20-year retirement, that's $34,000 lost. Not to market crashes, not to bad investments, but to preventable decline. And that number doesn't include loss of productivity, dependence, or reduced quality of life. Why prevention is finally becoming economic. For decades, prevention was encouraged emotionally, but punished financially. You paid up front while treatment was subsidized. That imbalance is starting to change. In July 2026, new Medicare Part D updates made certain longevity and weight management medications more accessible. For the first time, prevention is becoming economically aligned with retirement planning. This creates a rare window. Money once drained by medical costs can now remain invested. quietly compounding instead of disappearing into prescriptions and procedures. Longevity is a financial multiplier. Every dollar you don't spend on preventable medical issues is a dollar that stays in your system. Invested, compounding, protected. Spending $50 a month on prevention can help avoid a $50,000 medical procedure later in life. That difference is not luck, it's structure. Longevity doesn't just extend life, it multiplies financial outcomes. A healthier person works longer if they choose, withdraws less, needs less support, and maintains independence. That's real wealth. Longevity finance. This intersection of prevention, policy, and capital is what we call longevity finance. It's not about living forever. It's about avoiding financial collapse late in life. Your retirement is not just a number on a statement. It's your ability to walk without pain, to think clearly, to live without fear of medical bankruptcy. Health is no longer a lifestyle choice. It's a balance sheet decision. Why waiting is the most expensive choice. Most people delay action because the consequences feel distant. But biological decline doesn't wait for permission. Every year without prevention increases future costs. Every year of neglect compounds risk. And unlike money, the body doesn't reset. You either invest early or you pay later. There is no neutral option. The final reality. This strategy isn't reserved for the wealthy. It's available to anyone willing to understand the system before the cost becomes unavoidable. The real advantage isn't higher returns. It's lower losses. And the smartest investors in the next decade won't just be allocating capital, they'll be protecting their biology. If you want the full breakdown, the data, and the step-by-step strategy behind this shift, check the related video below. Because in July 2026, your health doesn't just affect your life. It becomes part of your financial future. And once you see it that way, you can't unsee